Congress is back in session this week as we take a live look over Washington, D.C. And the Enhanced Affordable Care Act subsidies are expected to be one of the top issues discussed. At the end of 2025, the enhanced tax credits that helped families under the Affordable Care Act expired.
So that resulted in health insurance costs going up this year for millions of Americans and a lot of families seeing their premium skyrocket. Our Christina Burgess joins us live now. Christina, you spoke with one Jacksonville father who's had to make a really tough decision.
Yeah, James David is a husband and father of two who decided that no insurance is the best move for his family when he noticed their premium nearly tripled. He tells me that he's now worried, in fear, and concerned for his family.
We're all having to make hard, if not impossible, choices about how to care for our families.
James David joins the millions of Americans forced to make difficult choices as their health care costs skyrocket. Enhanced tax credits under the Affordable Care Act, commonly known as Obamacare, expired at the end of 2025 after Congress failed to extend them. Those tax credits lowered monthly premiums by thousands of dollars. Across the U.S., more than 20 million Americans relied on them. Florida leads the nation in ACA enrollment with more than 20% of Floridians. That's over 4.7 million people enrolled. Without the credits, families like the Davids are seeing cost more than double.
We paid roughly $1,300 and some change in 2025 for health care for a family of four with the ACA. Without those subsidies this year, our insurance costs were going to be $4,000 a month. I don't know who can afford that.
David says seeing those numbers was overwhelming.
Stunned at first, but then I think the next follow-up reaction is automatically is fear, because it's what are we going to do to take care of our family?
Ultimately, his family had to make a hard choice.
The only answer for us was to literally not be insured. So as of January 1st of this year, my family of four is not insured. We're going to spend $36,000 on health insurance. We couldn't afford the mortgage or the car payments or anything else if we did that.
People simply can't afford some of the premiums that have been happening in this coming year.
Zanjanice Jacobs with the Covering Florida program says insurance navigators are available for free to help families compare plans based on their medical needs and budget. This week, the House is scheduled to vote on a 3-year extension of those ACA subsidies. But even if that passes, it likely won't pass the Senate, meaning higher health care costs could be the reality for millions of Americans for the foreseeable future. David has a message for lawmakers.
We're your constituents. We're the people you're supposed to be fighting for. You can't allow this to pass and not have some option for us. What are we going to do?
And it's important to add that not all Affordable Care Act subsidies are ending. Only the enhanced subsidies that were put in place in 2021 as a part of a COVID-19 relief. The original 2010 Affordable Care Act subsidies are still in place. They are just far less generous. Reporting live in downtown Jacksonville, Christina Burgess, First Coast News on your side.